While the Delta variant continues to dominate South Africa's COVID-19 caseload, Lambda is making its way through South America. The mutation, first detected in Peru in December last year, has been found in at least 31 countries. Well, Professor Barry Schaub, the chairperson of the Ministerial Advisory Committee on Vaccines, has confirmed that this variant has not yet reached our shores. But just how lethal is Lambda, and are our vaccines going to protect us from it? Well, we asked the director of the KZN Research and Innovation Sequencing Platform, Professor Tulio De Oliveira. Thank you so much for joining us, Professor. Lambda, are you worried?
Yeah. Good morning, Annika, and good morning to your viewers. Yeah. So just to explain to you, so what we have, and I am part also with other colleagues in South Africa of the World Health Organization variant identification group. Yeah. So what we have done in the past few weeks, is to more specific, mid of June, we have added another variant, which is the Lambda. It's a variant of interest. What it means, a variant of interest, it means that there is signs that's highly transmissible and potential that sign that slightly decrease the neutralization through previous infection. However, what we know from that variant, it is that it has been detected in 31 countries. It is dominating the infection in Peru, but so far it hasn't dominating infections on countries that currently facing waves through to the Delta. So that's important information, because at the moment what's happening in South Africa is that the Delta variant is basically spread everywhere. It took over the previous variant, the Beta variant, and the Delta variant is very highly transmissible. So at the moment, what we have to really work in South Africa is to try to release the pressure from the hospitals with the current Delta variant. Yeah. And what we also know about this Lambda variant, is that it has seemed to cause havoc in Peru. Yeah. What it means, havoc, very high mortality rate. However, the mortality rate in Peru, it has been associated also to the pre-variant, and they record not only COVID deaths, but excess mortality. So at the moment, the scientific communities try to tease apart if this Lambda, it is caused more clinical symptoms than the previous variants.
Prof, Lambda, do we know whether the J&J vaccine, the Pfizer, the two vaccines that our government is currently using, has the appropriate protection and effects on Lambda?
Yes. So what we know is that the Lambda has similar neutralization titers as the previous variant that we had in South Africa, the Beta. Yeah. So what we know at the moment, it is that the vaccines, especially the ones being rolled out in South Africa, the Pfizer and the Johnson & Johnson, are likely to be very effective on that variant. We don't see big warning signs that this variant would escape the current vaccines.
Prof, last question. There are going to be mutations happening all the time. It's to be expected. Is Delta really one of the worst that you've come across?
So in terms of transmissibility, it is the Delta has seemed to be the one that's the most transmissible. And that's why we have seen this very extreme third wave, especially in Gauteng. Yeah, so that's what the world knows. Not only the Delta, it is very transmissible in South Africa, but it's also dominating all the infections in the UK. It starts to dominate it in Europe, and also start to dominate it in the US. So it's a very highly transmissible variant. However, the vaccines are very effective against that variant, even more than the Beta that we have here. So more than ever, it is paramount importance that we vaccinated people as quick as possible, especially with the first dose, which also protect against hospitalization and death.
Thank you so much, Professor Tulio De Oliveira, who always joins us and gives us such incredible insight. Good news, the Lambda has a higher mortality rate, but is not as transmissible as the Delta virus and is working effectively with vaccines.